So, we know that cataracts are a cause of reduced vision, disabling glare at nighttime. In fact, patients, that have cataracts have 2.5 times higher risk of getting into a motor vehicle accident compared to patients that do not have cataracts. And this is a study from the University of Alabama at Birmingham. And there are very few accurate screening methods currently available to measure disability from glare from oncoming headlights, street lights, and bright sources of light. And lack of adequate documentation of this visual impairment in patients with cataracts may result in denial of coverage of cataract surgery. And again, I think it's important to make sure that we document this disability, just because it's unsafe for patients, to be driving if they have a significant cataract. So let's go on to the next slide. All right, so in the early 20s, Mentor stopped making the BAC, the brightness acuity tester. And there were really not any other glare testers around. And, so eye care practitioners would basically pull out their pen light or their pipe light and just kind of shine a light. And again, that wasn't very accurate. So I felt like there was a need for a device that accurately mimics and documents real life glare conditions in cataract patients. So let's go on to the next slide. So I developed a prototype that kind of looks like an ice cream scoop to measure the glare that patients, experience at nighttime. And this award, I got my first patent with this prototype. And the idea and the prototype was literally placed into a drawer for a couple of years. I really didn't do anything with it. The hospital that I have privileges at reached out to their faculty members, trying to encourage innovation, said, hey, if you have any ideas for any new technology, please, let us know. They were awarding grants to help further innovation. So I presented this idea to the hospital and the incubator group, and they liked the idea. They awarded me a $50,000 grant to bring the idea to market. And I subsequently received the Tech Columbus 2008 Innovation Award based on this innovation. So I initiated the commercialization pathway, and after completing the marketing studies, I worked with a team of engineers and optimized the design. All right, so let's go on to the next slide. Thank you. Perfect. So, the device is designed around a patented array of LED lights that simulates nighttime headlight glare. So the EpiGlare tester allows for documentation of the amount of visual disability resulting from glare experienced by patients with mild to moderate cataracts. So basically, the patient reads the standard Snellen chart while a virtual image of a headlight is illuminated through the eyepiece. And prior to developing the device, like I said earlier, there really weren't any reliable methods to test for glare from oncoming headlights in patients with cataract surgery. In patients with cataracts. So surgeons and other eye care providers, like I said, they, use a pen light or a pipe light and, would ask the patient to read this, Snellen acuity chart. And this test is very subjective because the intensity and the angle of light to the eye using these other methods is just not very consistent or reliable. So let's go on to the next slide, please. So we have 4 patents for this device. And then next slide, please. So the EpiGlare device has been validated in a multi-center clinical trial with 89 patients. 40 patients in the study had visually significant cataracts based on the LOX classification, and 49 patients had no cataract. And we showed a significant reduction in corrected distance visual acuity for patients with cataracts, while minimally affecting those without cataracts. Next slide. So it accurately simulated night driving glare issues for patients with cataracts. In fact, cataract patients in the study stated that the device accurately reflected the difficulty that they experienced while driving at night. And the investigators in the study rated the device as easy to use and useful. All right.
Alice, we have a question. Is the setting calibrated for regular oncoming headlights or the bright setting of oncoming headlights?
So that's a great question. So we have three different levels of light. So the brightest level is, what we typically see, with those bright headlights, LED lights. And then the second level is probably more of a standardized headlight. So we have kind of a bright headlight and then the lower level. Let's go on to the next slide here. So 76% of patients in the cataract group of our clinical trial, compared to 2% of patients in the normal group that didn't have cataracts, had a greater than 4-line reduction in visual acuity with glare testing. And next slide. So we published our findings in JRS in 2015. Next slide. So, again, the EpiGlare is a patented LED glare tester that is designed to simulate the disability that patients have with cataracts. Again, it's patented. It accurately and reproducibly documents the disability that these patients with cataracts have. And again, it's important to document that in the medical record, particularly if, patients are, like with insurance companies that are, auditing charts, just to make sure that you're documenting that disability. And again, you can do this without having to leave the lane like you typically would with like a bat glare tester. So next slide, I'm going to have Marcia, who is the Director of R&D and Manufacturing at Optigo Vision, just kind of go over a few other products that they have that members with GP Optho can take advantage of.
Yeah, thank you, Dr. Epitropoulos. I wanted to briefly introduce Optigo. We partnered with Dr. Epitropoulos about, it's been almost 10 years, and worked with her to commercialize the EpiGlare. So I, as Dr. Epitropoulos mentioned, I'm the Director of Manufacturing and R&D, and I've worked on this development of the EpiGlare. Optigo is a manufacturing and distribution company. It was founded about 30 years ago by an ophthalmologist in Tucson, Arizona. It's actually my father started it. He's an ophthalmologist. So I came on as an engineer and have been working to help some of the manufacturing, manufacture some of the products. In addition to the EpiGlare, we also manufacture a number of other eye care related products, including the post-mydriatic spectacles, like the slip-ins and the roller shades that you see here. And we also produce things like Fresnel prisms, the fake eye, which is a surgical practice eye, contact lens cases, and the eyelid clean, which is a silicone eyelid margin cleaning tool. We partnered with GP Opto earlier this year and are offering special prices on both the EpiGlare for both the handhelds and the 4-opter mounted versions of it that you could see in the previous slide. And then we also have special prices on the roller shades and these post-dilation slip-ins. Next slide, please. So you can go directly to our website to get our GP Opto pricing, which we're offering 10% off. You could just go to optigo.com and register for an account, and you can use the coupon code below. And then there's a question that just came in, and if you go back 2 slides to Dr. Epitropoulos' slide, you can see, yes, the question was, can you describe the handheld and 4-opter mounted versions of the product? So originally, this was developed as a 4-opter mounted device. So you can see in the picture here that it actually, that little device there has a battery in it, and it actually mounts onto the 4-opter. So you can test one eye or both eyes at the same time in the 4-opter. We also developed, based on customer feedback, a handheld version. It is the same device. It is just on a handle, and it comes with a bracket that you can place it in for storage. And both of those, are the exact same device.
Marcia, thank you for explaining that. And Alice, what a great presentation. Thank you. And what I really like, Marcia, is that you included some very basic products that we all use in our practices, like the post-mydriatic slip-ins and roller shades. And it's actually safety for our patients who need to drive home after they're dilated if they drove themselves to the ophthalmologist or optometrist themselves for a dilated eye exam. And actually, if Jim is on the line, he had his eye exam today in Michigan and had a heck of a time driving home dilated. He didn't get these. He should have. So it's a really important kind of object to give to our patients. They appreciate it so much. We used to hand these out as a compliment to everybody who was dilated, would ask them if they said yes, unless they had their own like prescription sunglasses with them, would offer them one of these 2 options. So thank you for bringing this very important device to our attention.
All right. And thank you for letting us present.
Yes, thank you.
Thank you very, very much.